All right. Hello, everyone, and welcome to our webinar today on integrating the national standards, strategies for building equitable systems of care for children and youth with special health care needs through the Title V needs assessment. Just a few points of housekeeping really quickly. All lines are in listen-only mode, and when we get to the Q&A section, what we will do is we will let everyone know that you can raise your hand, which is on the bottom screen. I've done a screenshot right here. If you raise your hand and you want to ask a question, just click that button. We'll be notified of that, and then we will allow you to unmute. You will be prompted you will be prompted basically to unmute yourself. There will be a pop-up box, and then once you unmute yourself, you can talk. So we'll do it that way, but also we do have a Q&A box. So please do, throughout the course of the webinar, submit your questions into the Q&A box, and then as they come in, we'll do our best to answer those. And then the nice thing about that is that then we have a record of what questions were asked and answered during the webinar. We will have an evaluation survey that will be sent out at the end of the call. We really appreciate it if you could fill that out for us and give us some feedback. We'd love to hear about how this work supports your work. Especially providing state examples, hearing from your peers. We love to hear the impact that this has on your work so that we can improve and continue efforts like this if it is successful in the future. As mentioned, today's webinar will be recorded and it will be sent out to everybody following the call, likely by the end of this week. Next slide. So we'll do this very quickly and we'll do it as folks hop on, but from our National Standards Project team, I'm Paige Busenich. I'm the Senior Program Manager for Children and Youth with Special Health Care Needs at the Association of Maternal and Child Health Programs. And today I'm joined by my colleague Kate Taft from AMCHIP, as well as Kate Hansberger, who's from the National Academy for State Health Policy, or NASHP, who is our partner with the National Standards Project. Once they come on, they will introduce themselves as well. All right, so today we have just a few learning objectives. First, we hope that everyone will recognize the national standards as a framework to connect stakeholders, understand the role of and implications for state Title V children and youth with special health care needs assessments and programming to improve systems of care, as well as utilize the national standards as a tool to identify inequities in care within children and youth with special health care needs serving systems. Really quickly, our agenda for today, shortly we'll do a really quick introduction activity. Then we'll run through a stage setting presentation as we know that people are coming to this webinar with varied levels of familiarity with the national standards. Then the largest chunk of our time will be spent listening to three wonderful presenters from 3 different states who will talk about how their states have used the national standards. Then we will wrap up and do an evaluation. So with that, I am going to launch a 2-question poll. You do have to answer both questions before you can submit your answer. So first, we want to know who's in the room. So many of you might wear multiple hats, and if you do, you can select more than one hat that you might wear. Zoom only allows for 10 options, so we tried to be as inclusive as possible. So if we did leave off your role, we do apologize for that. And then the second question is around how familiar you are with the national standards for assistance with care for children and youth with special health care needs. This is really helpful for us as it will help us to know how in depth we should go today when talking about the standards. So I'll give everyone a few moments to answer the questions. Thank you. Great. Well, it looks like we have about 55, 56 people who have voted. And I do believe that the votes just go through automatically once you select. Great. And looks like some folks are saying that it won't let them submit, and I'm not sure why that would happen. I do apologize about that. If it's not working for you, then feel free to chat in the chat box your answers. Great. Really happy to have everyone on. So I am going to end the polling and just share the results with everyone. So really exciting. We've got a large chunk of Title V staff on the call, as well as a mix of some other groups, which is really great. Nice that we have some care coordinators and people with lived experience on the call. The familiarity with the standards looks like, I guess a large chunk of you are at least moderately familiar with the standards, but we do have people who are just a little familiar. So we'll make sure that, you know, we may not have time to go all the way in depth, but we will make sure that we provide you with resources and TA if needed in the future. All right, so now I'll move to our stage setting presentation. This will be, we'll go through this pretty quickly just because we want to spend most of the time with our state presenters. All right, so just to kind of set us up with what's the challenge here that we're faced with. So unfortunately, most children with special health care needs do not receive quality care from the systems that were built to help them. As we know, nearly 1 in 5 children in the United States have a special health care need, yet 86% of children with special health care needs and their families do not receive care in a well-functioning healthcare system. Children and youth with special health care needs have higher needs for services and coordination across multiple systems and are more impacted by inefficiencies, gaps, and inequities in those systems. So if you can understand the needs and capacity gaps for the children with the most complex needs and address those needs within a system's context, you can make the system better for all children. Specifically, what we'll be talking about today is the Title V needs assessment process, which is an opportune process to understand what contributes to inequities for children and youth with special health care needs in a specific state or community, and then to strategize on what programs, partnerships, and systems changes can reduce these disparities. And then on the next slide, we just have a visual of what is the system that we are referring to today. So the system is where children and youth with special health care needs and their families are receiving services and supports from multiple systems, so that, such as healthcare, public health, education, mental health services, and social services, just to name a few. And within any one of these systems, children and youth with special health care needs may be served by multiple providers and receive more than one community-based service, which is illustrated by this care map that was actually provided by a parent of a child with special health care needs. So we know that Title V programs are specifically charged with providing family-centered, community-based coordinated care and facilitating the development of systems of services for children with special healthcare needs, and are often, the conveners to approach systems-level efforts to identify gaps and inequities in healthcare, and then those opportunities to improve care. So at this point in time, for Title V programs, folks have just submitted their needs assessments and block grants, and they're looking, those are looking at the holistic needs of maternal and child health and children with special healthcare needs providers. And so we feel that it's really helpful to have a framework that can be used to bring together families, state health policymakers, healthcare providers, health insurers, state children with special healthcare needs programs, Medicaid and CHIP programs, and other partners to work together to improve systems of care for children with special healthcare needs and their families. So now I'm going to turn it over to my colleague, Kate Hansberger from the National Academy for State Health Policy, and she will highlight the national standards and how it can be used as a tool to identify these inequities in care within children with special healthcare needs serving systems, as well as just touch on some state efforts that are in place currently. All right, thanks, Kate.
Great, thanks, Paige. Hi, everyone. As Paige mentioned, my name is Kate Hansberger from the National Academy for State Health Policy, and we've been partners with NASHP over the last several years in both developing and disseminating the national standards, and then working directly with states on efforts to use, implement, and adapt the national standards at the state level. So before I start talking really specifically about the national standards, I just want to acknowledge all the work that's going on at the state level to improve systems of care for children and youth with special healthcare needs. As I'm sure everyone on this call is aware, states are really employing a variety of strategies to improve systems of care for this population. Medicaid and Title V programs in particular have really been focusing on system improvement for children and youth with special healthcare needs. And while every state program is addressing the needs of their SHIN population in a unique way using a combination of strategies, this slide really shows that there's some overarching trends in the strategies that states are using. So NASHP has spent a lot of time looking at the trend over the last several years of states shifting children and youth with special healthcare needs into Medicaid managed care programs. These are programs that previously carved this population out of services and that service delivery system. State Medicaid programs are also establishing more specialized Medicaid managed care programs to serve children and youth with special healthcare needs and chronic and complex conditions. States are also implementing new models of care and redesigning how services are delivered through models like accountable care organizations. There's also an increase in the use of value-based payment models to serve children, like bundled payments to providers for episodes of care or performance payments for meeting defined quality metrics or standards. State programs are focusing more on how engagement and involvement of families of children with special healthcare needs and the design and implementation of their systems of care can enhance how well these systems serve families. There is a broad acceptance and promotion of the value of a medical home model for kids with special healthcare needs and the role that the medical home can play in coordinating care for this population. And finally, states are using tools like shared plans of care and establishing interoperable data systems to help improve access and quality of care for this population. So knowing that states are particularly active in developing and improving their systems of care for kids with special healthcare needs, the national standards for systems of care for children and youth with special healthcare needs was really created as a resource to help enhance and support efforts going on at the state level. Next slide. So in 2012, the Lucille Packard Foundation for Children's Health funded the Association of Maternal and Child Health Programs and eventually the National Academy for State Health Policy to develop and disseminate a set of national system standards for children and youth with special healthcare needs. And as this slide indicates, at the time that the standards were developed, there was plenty of research and frameworks and national reports that really underscored the need for and the importance of a comprehensive system of care for children with special healthcare needs. But there wasn't national consensus on what this system should look like and what the standards of that system of care should be. At the time, states were also in the midst of implementing changes to their healthcare delivery systems as a result of the Affordable Care Act, and having system level standards that outlined the core elements of a system of care for children and youth with special healthcare needs was particularly timely. And then finally, state health officials, family leaders, and other stakeholders were just really interested in having a standard set of system elements and processes that they could all agree on and use as a collaboration tool. Next slide. So in 2014, the National Standards for Systems of Care for Children and Youth with Special Healthcare Needs were released. The standards were updated to a version 2.0 in 2018. And for those who aren't familiar, the standards outline the core elements of a system of care for children and youth with special healthcare needs. Those core elements are identification, screening, assessment, and referral, eligibility and enrollment in health coverage, access to care, medical home, community-based services and supports, transition to adult care, health information technology, and quality assurance and improvement. Next slide. So this slide shows how the national standards were derived from a comprehensive review of existing literature, early guidance during the project from more than 30 key informants, case studies of standards currently in use within selected sites, and input and guidance from a national work group. That national work group was comprised of both national and state leaders representing Title V SHCN programs, health plans, state Medicaid and CHIP agencies, pediatric providers, children's hospitals, insurers, health service researchers, families and consumers, and others. So a very diverse group of stakeholders on the national work group. The standards are also grounded and aligned with the 6 core outcomes for systems of care for children and youth with special healthcare needs that was developed by the Maternal and Child Health Bureau at HRSA. And the standards are designed to supplement and support efforts at the state level, not substitute federal statute or regulatory requirements under Medicaid or Title V. So that's a very quick overview of the standards. The next slide just really briefly points to a resource that we've developed at NASHP to highlight and show kind of the reach and the impact of the national standards. So I know we'll be hearing from 3 state Title V officials shortly, but for those who are interested in other ways that states have used the national standards to improve their systems of care for children and youth with special healthcare needs, NASHP has published a comprehensive list of state uses of the national standards on our website. The link is on the slide here. But as the map shows, the national standards are really used in a vast majority of states in both Title V programs and Medicaid programs. So I really encourage folks to check out that resource if you're interested in specific ways that state programs are using the standards. And with that, I will turn it over to my colleague Kate Taft for our panel discussion.
Great. Thank you so much, Kate. Thank you all for joining us today. I am Kate Taft. I am the Associate Director for Child and Adolescent Health here at AMCHIP, and am excited to be moderating and introducing this panel. I love to transition from that wonderful map that shows the breadth and youth of the national standards, and so I'm excited that we have 3 state Title V leaders here today to share their perspectives and experiences using the national standards and the standards tools as part of needs assessment processes for children and youth with special healthcare needs and their families. So I will quickly introduce our speakers, but their full bios are on the agenda that you all should have received via email, and just so we can get straight to their presentations. But we are joined here today by Sarah Dunn, who is the supervisor in the Children and Youth with Special Health Needs program at the Minnesota Department of Health, and she coordinates the Title V block grant Children and Youth with Special Health Needs efforts there, as well as other children and youth with special health needs initiatives, including assessments, priority setting, and program planning. We also have Elizabeth Keenan, the Title V NCH Strategy Manager in the Bureau of Family Health at the Louisiana Department of Health, and she manages and coordinates Louisiana's Title V block grant program. And from the state of Florida, we have Johnny Hollis, who is the Bureau Chief and Director of Clinical Operations for the Specialty Programs Bureau under the Office of Children's Medical Services, Managed Care Plan and Specialty Programs. And as part of her role, Johnny oversees the administration of the Title V Block Grant for children and youth with special healthcare needs. So a wonderful panel here today, and I will turn it over to Sarah to kick us off.
Hi, I'm happy to be here today to share some about some of the lessons that we've learned in Minnesota when we've used the national standards in our Title V needs assessment and strategy development work. And go to the next slide. Over the next few minutes, I'll be sharing some examples of how we've incorporated the standards into our work. For the most part, the standards were used as a way to help us weed through the complexity of the processes and findings and help us lead toward ideas. A lot of our incorporation of the standards was done in the background, and honestly, it probably wasn't evident to a lot of our partners who we were working with. Therefore, a lot of our examples aren't literal one-on-one, but are more conceptual in nature. And so I've divided the discussion into our needs assessment work, and then we'll talk a little bit about strategy development. You can have the next slide. So first I'll focus on the needs assessment. Next slide. So this slide details the phases of Minnesota's needs assessment process. I think you can click again one more. Yeah. A summary of our processes is in our Title V application. I'm not really going to go too much into it. And we are also working on a broader manuscript that will lay things out in more detail. You can hit the next slide. So as a part of our data assessment activities, we conducted a discovery survey to hear from the community on their thoughts about the health and well-being of women, children, and families. Over 2,800 persons responded to the survey's 2 questions, which are on this slide, and they were, what is the most important thing women, children, and families need to live their fullest lives? And then also, what are the biggest unmet needs of women, children, and families in your community? Next. In conducting the qualitative analysis from the discovery survey, we referred to the standards to help us in categorizing the responses. So interestingly enough, many of the responses, as you guys probably also found in your needs assessment, a lot of the needs were more related to social determinants of health, and so weren't as applicable to the systems core domains in the standards. And so, you know, we heard, while we heard families were experiencing issues around accessing healthcare insurance coverage, accessing community-based services and supports, many others reported that they were struggling with childcare or housing, transportation, education, food insecurity, and other kind of items along those lines. Another lesson learned is that most families don't sort of speak in our core outcomes speak that we use, and so we found it was really important to adapt our messaging to best meet the needs of families. For instance, families are we found families very rarely would talk about medical home, but they would often talk about primary care and having, you know, feeling like their doctor was listening to them and that sort of thing. And so there was some kind of application to the standards, but we had to sort of make those inferences ourselves based on our knowledge we had. Next slide. For each of our candidate priorities, we developed a data story and a data placemat. The placemat was a tool that visually displayed data and information related to the priority. And so here's an example of the placemat that we had related to children and youth with special health needs. We can have the next one. We used the systems domains and information in them in the development of the data stories. Again, it was more so done behind the scenes, as some of the staff who helped write and review the stories had an understanding of the standards and used them to make sure that we weren't missing any important topics or points related to the priorities or to the needs of families. We didn't necessarily have the time to train all of our staff or reviewers or families on the standards before they helped us with the needs assessment and with the data stories and placemats. So it was helpful that we already had some staff who, like myself and some others who were already knowledgeable and could bring that insight into their review, which is an important point, I think, to make for everyone with the standards. A few years ago, Minnesota participated in an action learning collaborative related to the standards. And through our participation in that, we were able to train a lot of staff and some family partners. Since then, we've had some turnover in staff. Some of our family partners have moved on. And we are finding that maybe it's time again for another refresher to make sure that everyone is updated and that we all can integrate them better into our work. Next slide. So next I'll talk about our strategic planning. Like the needs assessment, our strategic planning process was implemented in phases. We started in early 2019 with the establishment of a steering committee to help guide us in planning the process. During the recruitment phase, we worked with partners to reach out to community members and others to participate in one of 11 strategy teams. We had one strategy team for each of our priority needs. Next, the strategy teams were convened during a development phase, and they were responsible for brainstorming and prioritizing 3 to 5 strategies to address their priority need. We completed our strategy development right before the Minnesota started to really be impacted by the COVID-19 pandemic, and the strategies were incorporated into our Title V 5-year action plan. Next slide. So one of the strategy teams that we facilitated related specifically to children and youth with special health needs. They focused on addressing our priority need, which was access to services and supports. Amongst a whole bunch of resources that they sent them to review, such as a framing document, we also sent them the strategies to help kind of get their ideas flowing. And we ended up coming up with a list of strategies and activities under each of those strategies that very much align with some of the principles set forth in the standards. Next slide. And then moving forward, we intend to use the standards, the principles in there, the frameworks in our action planning and implementation, which will help us to have the largest impact possible. We're particularly looking at the community-based services and supports, and our national performance measure for Minnesota right now is the NPM 15 around insurance and financing. So we're particularly looking at those as we're developing our work plan moving forward, and then also as we're going to be developing some different grants and things that we can do to help improve access to insurance. So next, that is it. Thank you.
Thank you so much, Sarah. I appreciate you sharing your experience on how it's really been integrated through your whole process. And I think what we'll do is hold questions and answers and comments till the end, but if people do want to use the Q&A function to chat in a question, we can also, if there are really specific quick follow-up questions, do them immediately after the speaker. So now I would like to turn it over to Liz Keenan to share what you've been doing in Louisiana.
Great, thank you. And thank you everybody for being on this today. We were originally planning to do this during our AMCHIP meeting, so it's still great to see about 100 people on today, so thank you. Before we dive into the details of how we integrated the standards into our needs assessment and then actually into our state action plan eventually, I just wanted to give a little brief context over our, regarding the evolution of Title V in Louisiana since the last needs assessment. So in the 2015 needs assessment, we had two separate directors. We had a CYSHCN director, we had an MCH director, and almost all of our Title V programs were scattered throughout our Office of Public Health within different bureaus. And over the course of the last cycle, we have all been administratively united within a single department, the Bureau of Family Health. And that has afforded us a really great opportunity to take a different approach to this needs assessment, because in 2015, there were two separate needs assessments essentially that were conducted and then merged at the end. So you can go to the next slide, please. So with MCH 3.0 back in 2015, it gave us an opportunity to take all of those different programs and align them, at least in regards to the national standards. But since we were not part of the same bureau, it was really just more of an alignment. And now with moving forward into the next cycle, beginning this next month, we are finally in a position to be able to start doing some mutually reinforcing activities and try to move a little bit further down the MCH pyramid. So if you go to the next slide. Thank you. So this is just a little screenshot of our last, the 2015 state action plan, and it showed we are not strangers to the standards, the national standards. We certainly tried to align it within our last needs assessment and within our last state action plan, but our majority of our activities and our strategies and investments from the last cycle were focused pretty heavily on our direct service and enabling service clinics and services that we provided. So a lot of these strategies related specifically to the provision of services directly through Title V. And so while the standards were aligned with that level of service, we, as you'll see, we learned that we have a little bit of work to do with moving, applying the system standards to population level services. You can go to the next slide. So as we have all seen through the past few years, we've been receiving a lot more guidance, a lot more support, and encouragement from from MCHB, from AMCHIP, and other national partners to start thinking about how do we move in a more public health services and systems direction, population level, looking at population level strategies for CYSHCN. And so that's the approach that we took in the mentality that we grounded ourselves in going into the 2020 needs assessment. Go to the next slide. So a way for us to do that, we utilized a tool that some of you may be familiar with. We were introduced to this by the Georgetown crew. The results-based accountability framework provides an opportunity for us to really think very simply, what is the end goal that we're trying to achieve? How are we doing in getting there? What's really going on behind the data findings, and then to help guide us into a planning process. And so we used this framework specifically because they have it separates out population level accountability and programmatic accountability. So it provided us an opportunity to look at, how are we doing in regards to meeting the needs of the whole population, and not just looking through the lens of the populations that we're serving through our direct service clinics that we have been traditionally putting our investments towards. So you can go to the next slide. So with the 2020 needs assessment, what is the end goal that we are looking for? So we looked right to our legislative mandate and the mission of Title V. And we realized, for CYSHCN, well, actually for Title V overall, it is to obviously improve the health and well-being of all children and families. However, we do have a very specific mandate to provide and promote family-centered, community-based coordinated care, and to facilitate the development of such systems services. So really the end goal is you can go to the next slide, Kate, is, as we know, that all kids with special health care needs receive care in a well-functioning system. And luckily, because of all the amazing work that went into creating the standards of systems of care for kids with special health care needs, we have a North Star. We have a framework to be able to, we know what that looks like. We don't have to create that. So we have we already know what that should be looking like if we were, what a system that would support kids properly would look like. So we use that as our grounding base moving into the next part of the needs assessment. You can go to the next slide, please. So using results-based accountability, we tried to create, we used the national standards and turned them into just plain language end goals and applied the results-based accountability framework to. So the ultimate goal was for all kids with special health care needs to receive care in a well-functioning system. And then each of the boxes that you see below, they represent just more of a plain language end goal that is linked to a specific, one or two specific system standards domains. And then you can go to the next slide, please. So the next step in the results-based accountability approach is how are we doing? Go to the next slide. And we did this in two separate ways. So we looked at, how are we doing with meeting, with implementing the system of care as a state? And we, our CYSHCN epidemiologist referenced the tool that was compiled by NASHP for the compendium of data sources and different indicators that really helped us see what were the appropriate indicators within the National Survey of Children's Health that would help us measure our progress at a population level for each of the standards. So for each of them, she conducted, for each of the system standards, she pulled out specific indicators from the National Survey of Children's Health to measure our progress. And then how are we doing as a state Title V agency in supporting the development of systems of care? And so we used the another tool developed by NASHP, the single organization assessment tool. There are two different tools. There's a multiple organization assessment tool and a single organizational assessment tool. And we decided to start with the single one and just focus on the Bureau of Family Health, but we will explore the multiple organizational assessment tool in the ongoing needs assessment potentially. Go to the next slide. So this is an example of what the data analysis looked like for one of the end goals. So all CYSHCN are identified early and referred to appropriate services, and this was just an example of how we presented some of the data. I can go to the next one. And then we also, with the NASHP organization assessment, we developed 8 different work groups to work through these. Even though there is a fillable PDF tool available, we determined that it would be easier for us to translate this into a shared workspace. So we use Google Docs for this. And this is just a snapshot of really how rough, how raw we really got with it. And everybody was able to dive in and put their notes in, put comments in, and to really discuss, what our answers are for this, and to be able to provide a little bit extra context for us to stimulate more conversation in the next phase. So we did this for, we went through all 10 of the domains, and there were lots of people involved. We had about, I believe, it was about 20 people involved in this process. Go to the next slide. And so the next phase is what's the story behind the curve. So what does this really all mean, and how do we move forward? And so we did it was about a half-day meeting, and this is pre-COVID, so we were able to do it in person. And the flow was set up like this, where we did a high level. We went through each of these end goals, went through what did the data say about how we're doing, what are the main findings about how we're doing as a Title V agency in meeting our legislative mandate in regards to this specific aspect of the system, and then some clarifying questions and some brief discussion to help people clarify anything that wasn't clear during those high-level summaries. Go to the next slide. And then the second half of the meeting, we had a much larger discussion, and we used that time to also to reflect upon the findings and identify or do our preliminary prioritization. So we asked participants to name their top 3 suggestions for priority areas based off of what we just discussed and the findings from two deep dives. And if you go to the next slide, we had several top themes and issues that emerged. And all of these did actually make their way into the state action plan in one way, shape, or form. However, this is where the presentation was going to stop when in March, because this is where we were up to then. But obviously, COVID happened and we had to change our plans. And now we can actually tell you how this really turned out within our state action plan. So specifically, one of the major themes that just kept coming up was regarding leveraging the high quality work in our direct and enabling services to drive systems level change. We realized that we were applying the system standards as we intended through the last needs assessment and through the last state action plan very well within our direct service clinics and our enabling services. Anytime that we were providing the service, we were making sure to reference the system standards. However, we really have a lot of room to grow in terms of our systems level work across health systems, across different coalition building, and lots of anything that's really outside of the direct and enabling service realm. So you can go to the next slide. So what we went through a series of prioritization exercises, which we had to change, and we did it virtually. And so we also had to do some virtual state action planning sessions. And the group that was working related to CYSHCN, their challenge was actually very similar to Michigan. The focus was on improving access to care and the coordination of specialty care. So access and care coordination were the two major themes. We had some sub themes, which you can see underneath the larger box. But the facilitators brought us through a series of exercises. There were 4 separate sessions over 3 weeks, and helped us narrow down some challenge questions of, what do we really need to focus on? And the goal for the groups was to identify a shared project that was really going to be mutually reinforcing, that's going to help propel us together to enhance our impact, expand our reach, and improve the quality of our work. So one of we had a couple how might we questions, but the one that is very relevant to this and that ended up actually rising to the top was how might we continue this internal evaluation to make sure that we are always providing best practices in order to meet the national standards of care for CYSHCN. So if you go to the next slide. Ultimately, that's what we continued working at that, and this is what ended up in our state action plan, at least the essence of it. The main shared strategy for the CYSHCN domain, in addition to all the different programmatic strategies, is we decided we need to really implement the system standards for CYSHCN across all of our Bureau of Family Health programs and initiatives that support CYSHCN, especially the systems level, the systems focused initiatives. We've realized that a lot of different programs that maybe were traditionally considered MCH territory, or that were not traditionally within the CYSHCN bucket in previous years, that they are just as involved in supporting the system of care. And so we need to increase staff knowledge across all of our Bureau of Family Health programs, and it's having a baseline understanding and ability to utilize the standards in a way that can enhance the work across not just clinical care, but all the different aspects. It's really critical. So we are, so 2 of the main approaches, we are focusing on increasing our staff knowledge and the utilization of the system standards, and then also to develop a systematic process that is going to help guide the implementation of the standards across our different programs, and provide a framework for us to ensure accountability and support continuous quality improvement. So we have some starter tools, and this using the tools that we used during the needs assessment provided a good baseline, and we plan to build on that and customize that to our agency. And we also wrote in our application that we intend to seek out additional technical assistance and support from from AMCHIP and the NASHP crews, because so far they've been very, very fantastic with helping us with the assessment, and especially now that we want to expand knowledge across all of the Bureau. We realize there are a lot of tools and resources available that we plan to take advantage of. So on that note, thank you very much to AMCHIP and NASHP, and to all of you for participating, and looking forward to any questions.
Thank you so much, Liz. I guess one benefit of the delay in this session is that we got to hear how your story ended. So, or this part of your story ended. I'm actually really excited to see how the implementation goes, and offer support there, and using the standards for your systems change efforts.
Thank you.
Now I'd like to turn it over to Johnny Hollis, and to share what you've been doing in terms of using the standards in your experiences in Florida. Johnny? Oh, Johnny, I think you're muted.
How's that now?
That's great.
Great, thank you very much. It's great to be here, especially learning from other states such as Minnesota and Louisiana. Next slide, please. In Florida, the standards are very near and dear to our heart, as the 2.0 version is dedicated in the memory of Phyllis Sawyer, who served as our former director here for us at Children's Medical Services for many years and was a past AMCHIP president. Dr. Sawyer was a long-standing visionary for children with special healthcare needs and helped develop and shape the standards into what they are today. Next slide, please. So just a quick illustration on how we are organized here in Florida at Children's Medical Services, which really helps to speak to the leverage opportunities that we have as part of our Title V program, which includes our specialty contracts, also known as Networks for Access and Quality, and our Medicaid Managed Care Plan, the CMS Health Plan for children with complex medical complexities. In Florida, we do have 4 million children, and about 20% or 800,000 are identified as children with special health care needs, with about 80,000 with chronic medical complexities. Next slide, please. Like some of the other states that we've heard from today, our needs assessment also focused on the standards. We used an integrated framework with the standards that really helped set the foundation and helped us be grounded in our needs assessment and action planning process. As our National Outcome Measure 17.2 incorporates many of those areas of standards, we also use that as a baseline, which aided in the subsequent identification of our priority needs. Integrating the maternal child health and the public health prevention pyramids along with the standards actually made sure that once our priorities were determined, that we included other focus areas within those priorities and in creating our action plan. So this allowed us to make sure we were inclusive of primary, secondary, and tertiary care levels, as well as our family partnerships, the social determinants of health for health equity, life course, workforce development, and those other essential public health services. Next slide, please. With family and youth voice driving our needs assessment process, we also wanted to make sure we were assessing the various strengths and needs of our organization. As already highlighted, the single organization assessment tool was developed in conjunction with the standards to help organizations assess how well their system is structured to assure access and quality of care, and it can also be used for action planning. In Florida, we are still in the early stage of implementation with this tool, but we've had some exciting developments as well as lessons learned that we wanted to make sure we were sharing with you. While we attempted to use this as part of our 5-year needs assessment, we did end up having a low return rate. However, I did want to highlight another way that we've implemented the tool as part of our ongoing or annual needs assessment with both our regional and statewide networks for access and quality. As part of our statewide network, we have contractual partnerships with 22 tertiary care system partners, such as children's hospitals and academic medical centers. And they represent various chronic disease and conditions, including endocrine, pulmonary, HIV, hematology oncology, our chronic kidney, and cleft lip and cleft palate. As part of their contractual task, they are required to complete and submit this tool annually. We then review their results individually, and collectively we look at the strengths and needs at the organizational level, the system level, as well as critical areas that need to be addressed as a state. This really helps us break down those individual silos and improve collaboration and learning across institutions as a statewide network while monitoring for themes and trends. Let me show you a couple of examples of this in the next 2 slides. In this example, we're looking at standard 1.5, which assesses the standard of having policies and procedures for screening in accordance to the guidelines. This data is representative of 5 of our HIV programs across the state. When we compiled their individual results together, we can see that 4 out of 5 have policies and procedures, with 3 out of 5 answering that they were very effective, and 1 of those partners answering that they were somewhat effective. And we also had 1 outlier that did not have a policy or procedure for this standard. Compiling their information this way gives us as a Title V agency the opportunity to follow up with the 1 provider that didn't have the policy and procedure and provide technical assistance, including offering to bridge that partner in with their other system partners for information and sharing with what they are doing in this area. This is done in an effort to increase their capacity over time with this specific standard for our population, with the goal of standardizing best practices where we can. Next slide, please. We can also use the tool to monitor improvement and enhancements over time. In this example, we see standard 3.1, or access to care. This standard looks at the organization's ability to identify healthcare providers that serve children and youth with special healthcare needs, such as primary care and specialty providers, with the inclusion of oral health and mental health. Historically, at least here in Florida, we have seen inequities with the inclusion of mental or behavioral health being prioritized in the overall monitoring of health and wellness with our population. In this example, you can see where this organization actually improved their identification of mental health providers from their baseline assessment to their follow-up. So this call out specific to mental health was great to see in our review of the data, especially with the widening disparities in regards to mental health as a result of COVID. As a side note, our state performance measure in Florida is increasing access to mental health services. So our contracts are also required to create a mental health referral process and policy and have quarterly reports on the number of those that were identified as needing or receiving or following up on a referral, along with those actively receiving mental health services. So this could also account for the increase in this indicator. Next slide, please. In our implementation with our specialty contracts, where they were required to use the tool, some of our lessons learned were that they needed a lot of technical assistance and feedback in how to complete. There were challenges and barriers with these provider types, really understanding how they fit into the larger system of care, even though they serve the children with special healthcare needs population. In the future, we are wondering about the development of a domain for specialty care that is not inclusive of primary care. We also found that when components are skipped or missed, it can be very difficult to trend results over time. As I highlighted earlier, in our dissemination as part of our Title V needs assessment for our 5-year planning, we did have a very low return rate. So next time we do plan to enhance our messaging as part of this, as well as scheduling time or offering office hours to help assist providers in the completion of this tool. We are curious if the tool is sensitive for the inclusions of organizations that aren't dedicated entirely to the children and youth with special healthcare needs population, or inclusive of systems that are at a functioning level. In other words, are the standards missing components of important system stakeholders, such as our community mental health providers, our child welfare agencies, hospitals, and other specialty organizations. In Florida, these are some of our biggest stakeholders, along with our primary care providers. Next slide, please. So in next steps, we are looking forward to completing this tool with our other system partners, such as Medicaid and our CHIP program, as well as our MMA plans, including the CMS Health Plan. and as well as our family organization stakeholders. Doing so actually gives us the opportunity to compile the results into the multi-organizational assessment tool for a true system composite where we can identify strengths and needs for future action planning. As an additional leverage opportunity, we do plan on utilizing the framework set forth in the National Standards Measure Compendium, which is a compilation of data and quality measures from various sets. As our various partners, such as the CMS Health Plan, already collect some of these standards measures, such as our CAHPS, HEDIS, and quality of life, compiling them together with all of the measures we're collecting as a system in this organized framework, and then having them in a data dashboard system will help us better drill down those various subcomponents to further evaluate the foundations and standard domains that make up our system of care. We look forward to these opportunities for the development of a more robust quality improvement efforts and action planning for our children and youth with special health care needs and their families that are reflective of our system of care national standards. Thank you.
Thank you so much, Johnny. That was a wonderful presentation on how you've used the standards and tools to assess and understand how your system is doing and pinpoint some needs and see where there's improvement. That's fantastic. So thank you for sharing, and thank you to all of our presenters and panelists. This has been a wonderful learning experience. I don't know if we have any, let's see if any questions or raised hands, but please feel free to drop in a question or raise your hand. I think we have a few minutes where we could take some before we get going. But as people are thinking, I did want to kind of pose to any and all of our panelists if you wanted to comment with any parting thoughts on messaging around the use of the national standards for understanding the needs and driving systems change. I know that the theme of messaging and working with partners and thinking about increasing staff knowledge and training came up a lot in all of your presentations, as well as the language. So if anyone has some final thoughts there on like one takeaway that you'd like to share, please feel free.
This is Johnny. I'll get us started. Just really in our messaging, emphasizing the value, the need, and the importance of completing this information. We know everyone has competing priorities, but even offering to sit down and provide that technical one-on-one assistance to make sure that they've got dedicated time to walk through the tools and be able to answer their questions and completing and filling it out, we found to be very helpful in implementing our assessments based on the national standards of care.
Thank you, Johnny. Okay, well, again, thank you all so much. I know we have a couple minutes left, so I just wanted to turn it over quickly, or turn it back to my AMCHIP colleague, Paige, to share some final points and resources. And then thank you all for joining us today. Paige?
Yeah, great. Thanks so much, Kate, and thanks to our panelists. So here on the slide, we just, for ease of accessing, we including some QR codes for accessing the standards, as well as the tools and resources, as well as our National Standards Online Toolkit that is housed on the NASHP website. Next slide. And then I just put this in the chat as well. We'd really appreciate it if you could complete our brief survey, just letting us know your feelings about the webinar, how it went, your takeaways. We always love to hear what people are learning from our learning opportunities. And then next slide. finally. This one just includes a whole bunch of links to all of our resources, many of them that were mentioned on the call today. So again, the National Standards Toolkit houses everything that you need to access to use the national standards. And then there are plenty of other state examples of how states are using the standards in their healthcare systems and Medicaid managed care, as well as all of our assessment tools, and then the measures compendium and a set of quality measurement modules. So, and then a new resources are the one-pagers for key standard domains that NASHP just developed. So we will send out the slides and the recording and the evaluation link to you all. Thank you all so much for being here today. We really appreciate it. And we wish you all well. Thank you so much.